Hello and welcome to Conversations. I'm Jim Blow, your host. Very pleased to have joining me today, Washtenaw County Sheriff Jerry Clayton. Welcome back to Conversations.
Hi, Jim. Happy to be back.
And we try to get you back on to sort of update the county and the city on what's going on within the Sheriff's Department. And in the last couple months, a special program and what will be a Voice of the People of the County coming up in November for a special millage for the Washtenaw County Mental Health and Public Safety Preservation Millage.
Right, that's a mouthful.
It is a mouthful. First of all, with respect to the Sheriff's Department, what would this millage do?
So, I think the Sheriff's Office piece is probably the simplest. We provide most of our police services through contract with a lot of our local jurisdictions. We call our contracting partners.
That would be primarily the townships.
The townships. An example would be Ypsilanti Township, but also the village of Manchester and a lot of different jurisdictions in between. About 10 years ago, we settled on what we call a police services contracting methodology, which had an architecture for the financial piece. Everybody knows everything that led up to that.
Yeah.
Well, there's a difference between the cost and the price. And that difference has slowly increased from around $28,000 to now
Is that for the year for the whole department and the contracts?
No, that's per PSU. So
PSU
we have,
being?
which is a police services unit.
Okay.
So they contract for a police services unit, not just a deputy, but everything that goes into supporting the delivery of service. So the county picks up the difference between the cost, which we believe to be a certain amount, and the price that we charge our contracting partners. That's for each PSU. So we have 79 PSUs now, and we're talking somewhere between 30 and 35,000 per PSU. So over a period of time, that cost has continued to increase. Now, the Sheriff's Office hasn't gone back to the county for an increase. We've been able to manage it internally, but we knew 2 or 3 years ago that wasn't a sustainable model.
Why not cover that cost, the expense of providing police protection to the county with the basic general tax dollars that the county residents are contributing?
It's a great question. And I'll try to be brief. The first thing is constitutionally in the state constitution, it doesn't mandate that the sheriff provide road patrol services.
Oh, really? Okay.
There is a mandate that we respond to emergency calls, but there was an interpretation at the state Supreme Court that the final analysis is it's not something the sheriff has to do. The county of Washtenaw chooses to do it.
And that's the ongoing, not random, but the not 24 hours, or is it 24-hour service?
Yeah.
Just the road, as you say, the road patrol,
the
monitoring of the different service areas.
That's right. Responding to calls for service, proactive patrol. We're not mandated to do that the county already invests at a certain level, but for enhanced services, each jurisdiction contracts for the number of deputies, PSUs, that they believe will meet their needs.
Okay.
The county has chosen to continue to help fund that. So you said, well, why not just continue it and not ask for a special millage? Well, we're at a point now where the county can't continue to fund at current level. They will either have to redirect money from the existing general fund, which means we're taking from another program to continue to support at the level that they're supporting, or they have to charge the contracting jurisdictions the true cost. And quite frankly, Jim, there are a number of jurisdictions that just can't afford to pay.
And all right, let's look at two things. One is, as you say, if the county on their own were to pick up the difference, it would mean choosing that the sheriff patrol was a higher priority than other programs and other services the county provides.
That's exactly right.
So there's that way, and that would be a decision the county board would have to make, or to charge the units, the townships and the areas that are contracted the full amount, in which case those that could not afford it would most likely not have would only have the emergency, you say, calling service area.
Right, they're left with a couple of decisions. Wait for a general fund deputy to be available, and that could be some time. Depend on the Michigan State Police to be their primary responder.
Okay.
And quite frankly, a couple of years ago, the Michigan State Police left their post in Ypsilanti Township, and now they are stationed in Livingston County.
Right. So Washtenaw County is serviced by the state police coming out of what, the Brighton Howell area?
That's exactly right.
Okay.
And there are oftentimes state troopers in the county, but there are times where there are no troopers in the county. Or the other option for those local jurisdictions is form their own police department.
Okay.
And when you think of the overhead and everything associated with that, it's not the most cost-effective approach.
All right, so in looking at this millage, the county board determined that the best approach, or the approach that was going to be looked at now, is going to the voters of Washtenaw County, asking for a millage to, would it defray the full cost of patrol, or reduce the difference?
That's a great question. Well, really what we're trying to do is sustain the existing architecture.
Okay.
So if you look at the county's existing investment, to maintain that investment and to slowly increase that investment over time. And really all we're trying to do is to keep the rate of increase of the price to our contracting partners as minimal as possible. So over the last 5 or 6 years, we've been able to keep the yearly increase to about 1% or 1.5%, which is really less than the cost of inflation when you think about it. Really all the millage will do, at least a portion for police services, is to maintain that trend where we see maybe 1%, maybe 1.5%.
Would it potentially, you say, roll back? As you say, it began at about what, 28% cost?
$28,000 per PSU.
Per PSU. And has creeped up over the years to about how much today?
About 35.
About 30. So about a $10,000 increase. Would this millage simply go from the $35,000 now and say we're going to help cover the cost beyond, or would it sort of take a partial step back to say we're going to increase the amount that the county provides through this millage so that the townships are not being charged X amount more?
It won't roll back anything, not from the county's perspective or from a contracting jurisdiction perspective. It just provides enough funds to stabilize the service and to keep the increases at the same rate that we're seeing now, 1%, 1.5%. We've tried to contain costs within the sheriff's office, and we've actually been able to do that because there's been a rise in costs without an increase in the actual allocation to the sheriff's office. But we're beyond our capabilities to do that. And quite frankly, without a millage like this, here are the only options, and I'll be very brief. If the millage does not pass, now the county's at a point. Do you continue to invest? Do you increase that, or do you say we're getting out of the business? I'm hopeful that the county doesn't get out of the business. If they stay in the business, then they'll say, well, we need to pass the full cost on to our contracting partners. Now the contracting partners have a decision. Do we pay full cost? Do we depend on the state police? Or do we form our own police department?
You mentioned, if I understand correctly, the county has picked up the increased cost over the years, and the partners have contributed the same amount, pretty much, you might say, all along.
No, they've also increased their costs too. So their costs go up at least 1%, 1.5% every year.
And the county's commitment also increases.
Right. But the county's commitment has stayed within the sheriff's office.
Okay.
So we in the sheriff's office have been able to pick up and manage the difference.
Has there been discussion that would it be possible to say that the increased difference would all get passed on to the county or the townships, so that your office and the county's, you could say, commitment is stable?
Right.
And any addition, as opposed to saying you're all going to have to pay for it all. Right. You know, that. So
my belief is if the millage doesn't pass and the county says, well, without that money, we're going to hold our commitment right at this level, any future increases go directly to the contracting jurisdiction. That's an option. The question becomes, is that too much of a financial burden? We have one of our jurisdictions that 70% of their general fund budget supports police services contract. And I just want to add one little piece, Jim. And so for folks that have their own police departments, City of Ann Arbor, Pittsfield, that say it's not my issue, it's an out-county issue, here's what we know. Crime doesn't know boundaries. So it is our issue. So if you take away police services countywide, you undercut what I think is a foundational structure and support for police services in the county.
And we should also look at the millage as proposed. The millage doesn't go just to defray the cost of the protection and preservation of the system as it is now. About what percent of the total millage would go to the preservation of the policing aspect?
So 38%. So there's a 38% carve out for police services, and there's a 38% carve out for mental health.
Okay, and then, all right, so my math isn't real quick, but that leaves us with still a fair amount.
24%.
24, okay.
Right.
And where does that 24% go?
That 24% goes to the jurisdictions that have their own police departments.
Okay.
So that is the cause for some angst for a lot of people. But here's the belief that we had when we put this together, especially as we think about how we collaborate around public safety and addressing the mental health disorder and substance use disorder. This is a county-wide issue.
Right.
And we're hopeful that the money that goes back to those jurisdictions will be directed into police services in those jurisdictions to help work on this mental health and substance use disorder strategy. Right. So we're talking about a new strategy to address these two challenges. The millage provides an opportunity for those jurisdictions to use money to help support those strategies.
And you've mentioned before on the show that the whole mental health concern and issue is closely tied into public safety and policing, and that's a sort of a shared, you could say, need within the county.
Yes, it's been a challenge for us, and I know at some point we're going to talk to the executive director for community mental health in Washtenaw County, Trish Cortes. The sheriff's office and the mental health department have worked collaboratively to come up with a strategy for how do we address this issue. So let's not look at public health and mental health separately. Let's look at them together, because there is a nexus there between those two issues.
And we're going to take a short break now and come back with Trish Cortes, the executive director for community mental health in Washtenaw County, and have both of you address that aspect and the total millage plan. Ask our viewers to stay with us. We'll be back in just a moment. Hello and welcome back to Conversations. I'm speaking today with Washtenaw County Sheriff Jerry Clayton, and joining us now is the Executive Director for the Washtenaw County Mental Health Department, Trish Cortes. Welcome to Conversations and joining us.
Thank you, Jim.
And we had talked before the break that the Sheriff's Department was potentially going to receive 38% of this millage proposal. Mental health for Washtenaw County would get the other, not the other, but an additional 38% also. First of all, what does the Mental Health Department for Washtenaw County do? What do you oversee?
So community mental health is the safety net provider for individuals with serious mental illness, youths with significant emotional disturbances, and also youth and adults with intellectual and developmental disabilities. Okay. So we are the safety net provider primarily funded through Medicaid.
And what types of services will your department then oversee?
We have a broad array of service that we do at community mental health, unlike traditional health plans and insurance coverage. So in addition to psychiatry, nursing, therapy, what community mental health does is do a lot of case management, support employment, skill building, a wide array of services that
and
are
that's
really
throughout Washtenaw County. Now, do you work with whether it be cities or townships directly, or is it all through just sort of the county-wide program that a person who might need your services would come to you as opposed to some other agency?
Correct, more of a county-wide system.
And getting potentially 38% of this millage, what are your needs and why are you looking to the voters for a dedicated millage?
Well, back in 2014 into 15, concurrently with the implementation of Healthy Michigan, which is Medicaid expansion here in the state of Michigan, the state also made a financing decision to defund about $200 million worth of state general fund dollars across CMH statewide. That for us was a 60% reduction in our funding, so we went from 6.8 to 2.8.
That's $1 million a year for running the programs that you run.
Correct, and that's particularly those are the flexible dollars that we had to do services outside just the Medicaid population or mandated Medicaid services. Okay. So that has created quite a hardship in terms of that we can no longer be the safety net provider the way that we have historically been in this county.
And that's financed, once again, through funding from the state, but passed through the county board of commissioners, who then passes it on to your department.
Correct. They pass it directly to our department. Yes.
And so it's a similar issue as with the sheriff's department, of the county board having to make a decision potentially of what priorities, where will funding go, that they have not disposable income, but that income which is not preset by contract, by employment, those things they have to pay for. At some point they have to decide where will the other money go.
They will. And our funding has been reduced so much that right now we are obligated to have to provide urgent or emergent services with our remaining little bit of general fund dollars, and that's all we can do at this point. So there's no prevention, et cetera.
Is your department mandated by the state? You mentioned the Medicare or Medicaid funding that you are mandated to provide. But as far as the rest of the community in Washtenaw County, is that mandated by the state, or is that what the county has said over the years, we want to provide these services?
Well, historically, we've made some decisions, which really has been part of the purview of the CMH board of where we wanted to use those flexible dollars.
And that's community mental health.
Correct.
Right.
Correct.
And Sheriff, mental health, we mentioned before, is something that overlaps with the Sheriff's Department in that, do you have a sense of the people that you say deal with as, whether it be violators of the law or just people that you're trying to support, mental health issues as a percentage of the total, where that falls?
Yeah, so two things. So let's talk police services first.
Right.
Our data shows us that we respond to specific calls for services of emotionally disturbed persons, usually people with mental health challenges, at least on average 2 per day. So those are known responding to those calls. And there are additional calls that we respond that weren't specific to an emotionally disturbed person, but we find out after the fact that they have a mental health issue. So it's a constant challenge for our police services staff. In corrections, what we know, we did a snapshot last year and it showed that our population runs right around just under 400 inmates a day. We found out that 56% of that population are on some kind of psychotropic medication. So it doesn't mean they have a severe mental health issue, but the issue is at least important enough or significant enough where they're on medication for it. And then we look within that 56%, and 70% of that 50% have some kind of co-occurring disorder, so some kind of substance use disorder. And quite frankly, we're not equipped, although we contract now with mental health to provide CMH services in the jail, it's still reactive, the way we're constructed. So we have become the default mental health facility in the county, and that's just not acceptable. And we know people with mental health issues, the worst thing for them to be is in confined spaces and not being able to get the kind of services that they need so they can actually function as contributing adults back into the community.
Has your mental health department or anyone within whether the state or nationally been able to do a study that can demonstrate or show that preventive efforts reduce the population in, whether it be in jails or in calls that police departments get, and that you can demonstrate that with additional dollars now you can save money down the road?
Yeah, nationwide there is an initiative called the Stepping Up Initiative, where the county kind of makes the declaration that they want to be a stepping up county, which then uses a variety of different strategies to try to help with the issue of getting individuals with mental illness not in jail and getting them the right treatment at the right time.
You mentioned both mental health but also physical drug addiction and that, and over the last couple months there's been more and more media focus and attention on the opioid crisis and that. And within Washtenaw County, how prevalent have you seen it, and how does it impact both your mental health department as well as whether it be the jail or the sheriff's department?
So I think community-wide, we've seen significant triple-digit increase, percentage-wise increases in emergency room visits, people suffering from opioid overdose. In August of 2015, we gave our staff Narcan, naloxone, which is the antagonist to opioid overdose. It reverses the effect. And in that time, our staff has made 55 saves. So it's 55 individuals who had overdosed and we pretty certain were going to die, that we've been able to reverse that. It is a continual issue for us. So we've seen not only increases in emergency room, we've seen actually I think it's a 400% increase in opioid-related deaths in the county. I might be off on that percentage, but it's significant. So if you hear the rhetoric around a national crisis, that is not overblown, and Washtenaw County is not immune to it. And the only other thing I'll add to it is it's not one specific area of Washtenaw County. We're seeing overdoses throughout the entire county. So it doesn't know socioeconomic limitations. It's not a racial issue, it's not a gender issue, it's not an age issue. We see it across the entire spectrum.
And that's what I was going to mention or ask with respect to the community mental health, that often people assume incorrectly that mental health addresses a very sort of select client, where in the case of the opioid, as the sheriff mentioned, it's really widespread. And have you found that in your, I would say, efforts within your department of how you address it? It might be different than you might address other factors?
Well, one thing, Jim, to keep in mind is that in addition to the opioid epidemic, we're also seeing a startling increase in suicides among our young and our youth. And those individuals are not being treated currently by community mental health. These are individuals that are not necessarily low income. These youths are not our typical CMH type population. So I think
and they're only getting help if there or someone near them recognizes signs and says, let's get someone to help you.
Absolutely.
Yeah.
So Jim, I just wanted to follow up really quick. I don't do a whole lot of data, but I think this is important. So here's what we're seeing in Washtenaw County between 2015 and 2016. So a 20% increase in total suicides from 2015 to 2016, a 400% increase in suicides among young people, and a 900% increase in opioid deaths among young folks. And we know that number would be even higher if it wasn't for Narcan. So not only the sheriff's office has it now, but it's throughout the county with other agencies. And then we're having more than a death each week from opioids. So that's a 28% increase that we've seen from 15 to 16, and we've seen it probably when we get to the 17 numbers, we're going to continue.
Is any of that based on, you could say, identifying the cause today compared to, say, 5 years ago? Or is it purely that the opioids are more prevalent and more people have access and there's less willingness to sort of restrict the use of it, so to speak?
Well, I think it's all of that.
Yeah.
It's all of that. We're seeing a lot of our youth are becoming addicted by, quite frankly, looking in their parents or their grandparents' medicine chest, and they get addicted to whether it's OxyContin or one of those opioids, and then that then translates to cheaper, more potent drugs that you're finding on the street.
Right. So remember, I mean, there was a time where the medical profession, they were being criticized for not paying attention to pain.
Right.
And then they were taught and encouraged to pay attention and treat pain. Right. And one of the biggest ways to treat pain was opioids. So now we're starting to see the effect of that. When you see prescriptions that are lasting weeks for certain procedures, and at the end of the day, a lot of time that medication is left in the medicine cabinet, right, or that person has taken it all. And there are some studies that show it may only take 2 or 3 doses of an opioid before you are addicted. So it just depends on who the person is and their reaction to that kind of introduction of a drug. So we're starting to see the effects of decisions that were made a number of years ago.
And Trish, as the county mental health executive director, if the millage does not pass, would it be fair to say your department really can only, once again, deal with, you could say, the emergency aspect, and that any preventative or proactive efforts to address the issues that we're looking at from the sheriff's department perspective will not be able to occur unless there's a change in sort of structure at the county level of what gets funded?
That's correct.
Right. Okay. And any final words, Sheriff, as far as both the millage and but also what your department is facing today and how the people can support you?
Yeah, I believe that it's an important issue, a watershed for the county. So not only from a public safety, but a mental health and substance use disorder. And I want to make it really, really clear. We have worked in partnership now for over 2 years. So we're not just started, we have started, and we've already put some things in place. What the millage would help is to continue the proactive strategies, to actually work with the stakeholders, the nonprofit organizations, the healthcare systems, as we look at, how do we, from a system standpoint, provide the kind of services that people want to address mental health issues, substance use disorder, and equally as important, public safety.
And it would also be fair to say that the millage is really trying to either maintain or bring back to a level of service that Washtenaw County had seen. It's not that there's sort of wild and crazy new proposals that are being planned. It's more, let's do what we've been good at doing, but now funding has been cut, or it's difficult to maintain that without additional support.
Yes.
Yeah. And just the last piece, there are a couple of new programs. So law enforcement assistant diversion, which will keep people out of jail who have some substance use disorder and mental health issues. And we'll end with this. A person that's in our jail, it costs about $135 a day. We believe the proactive strategies that keep people out of jail and address root cause issues can be done for as low as $35 a day. We've seen it in our community corrections, and we think that's the best way. And quite frankly, that's what's aligned with Washtenaw County values.
Right. Well, I want to thank you both for joining me today. Trish Cortes, the Executive Director for the Washtenaw County Mental Health Department, and Sheriff Jerry Clayton. And thank our viewers for joining us today, and look forward to your continued support here on Conversations. Thank you.